All right. So as promised, very helpful. Okay, Miss Francis, thank you. Remember, if there's ever a video that I don't send you already, or that is not in the previous recording or whatever, if you know you want to look at it again, let me know. But just like YouTube, there are helpful videos that you can find. I always like to be the one to introduce the videos though, because I don't want ever for a video to be of confusing and you say, oh, she taught us this and said this. So just let me know if you do come across a video that you look at on your own and something strikes your interest. I can do what I can to make sure I explain it to you. So that's no worries. All right, so let me show my whiteboard, ladies. 707. Oh, Lord. It's like a gnat flying in my face. I'm giving it time to kind of load on my end. I know it's small as it's loading, but I'm gonna make it bigger. Oh, I just noticed something. Okay, 1, 2, 3, 4, 5. Okay, okay. Let me make it bigger. I will move it around as we go over a lot of the information. Let me know if screenshotting it is difficult for you. I can reduce it. And once you screenshot it, you can always, I believe, make it bigger on your phone or zoom in on it, okay? But this is medical terminology. You all have your books now. You have what you need. So with that being said, let's go ahead and try to take good notes, and I'll do what I can to explain everything. But like I said, a lot of you have medical experience, so some of this stuff may not be of difficulty to you at all, okay? So without further ado, let's go over to my left side. As I'm looking at my screen, I have 3 medical terminology words that's basically typed in the color brown. Ooh, sorry. If I messed that up for y'all, let me know, but I wanna kind of have it big when I'm explaining it so you can see it on your screen if some of you are on a cell phone. All right, so the first 3 words that I would like to go over. The first word is pronounced toxicology. We've already been introduced to one of these words, but toxicology. I hope that you all, if you don't know, I want you to know that the word toxic means anything that is too much for your body that can harm you, anything of too much that is of harm to your body. So, there's alcohol poisoning. So if someone get their alcohol level drawn and the levels come back extremely high, the doctor is going to say, oh, this is toxic to your body. Okay. Anything with drugs. Okay. It could be regular prescription medication, or it could be the illegal form of drugs. Anything too much for your body that actually harms you and puts you in a sick place, it is, excuse me, it is considered to be too much toxin. So with that being said, toxic, too much for your body that can harm you, okay? Ology, any word that has the ending word of ology, O-L-O-G-Y, means the study of. So this word means the study of toxins. Just like we talked about the different departments in the laboratory where they result the blood at, there is also a toxicology section in the lab. So, you remember I mentioned to you all that what's on your requisitions, that it tells us what color tube it goes in for the most part, but you see some other alphabets on there that is not in the order of draw. So you were like, what does those mean? Well, those are special laboratory blood draws and other things. So because some of those things could be going to the toxicology section of the lab. So I want you to be mindful, because in phlebotomy, in laboratory, even if you become a laboratory technician, you will hear of the word toxicology, okay? Meaning the study of toxins. And toxins is too much in your system or your body that can be of harm to you, okay? Next word is microbiology. We talked about microbiology this weekend because microbiology obviously is the study of something, right? So the word micro is short for the word microorganisms. So microbiology means the study of microorganisms. So there are people that study toxins. There are people that study microorganisms. Remember, microorganisms mean bacteria, fungus, viruses, parasites, all of those things that we consider to be a germ, okay? So there is a microbiology section in the lab. That's where all our cultures go. And by the way, over this weekend, we learned what a culture is. That means the doctor, there is some abnormality or some suspicion going on with the patient's urine, blood, mucus, saliva, or maybe they have a bad sore that's infected. So now we need to figure out what bacteria is living in that infection and what antibiotic is going to work for the doctor, okay? What antibiotic is going to work for the patient. It lets the doctor know what antibiotic he or she should prescribe. So anything of a culture goes to the microbiology section of the lab, okay? The study of microorganisms. For example, I put in parentheses, specimen cultures or cultures of specimen. Anything of culture, that should let you know it goes to the microbiology part, because anything that is needing a culture, the doctor is trying to figure out, like, okay, they have an infection. What's the name of that bacteria? Okay. Next word is very important in phlebotomy. It is, hold on one second, because I still see myself freezing up. I don't know if it's bad on y'all. Hold on if y'all can hear me. Hopefully, okay. Sorry, y'all. Oh my God, sorry about that. Just let me know if my internet acts up on your end. I won't mess with it no more. Okay, let me get my whiteboard back showing. So far, I talked about toxicology, and which is the study of toxins. I also talked about microbiology. I want to let you know also, this word hematology is the word that you're going to see often in phlebotomy. Any word that begins with HEMO or HEMA is another word for blood. That's exactly what it means. Okay. Give me one moment. I know it's loading. All right. So back to our words in this orange or brown type of coloring. It is, we're talking about the third word, which is hematology. So please remember the beginning of this word. If you do see HEMA or HEMO, it is another word for blood, okay? Hemo or hema, okay? This word hematology is the study of blood. So remember, the first word, the first part of the word means blood. The ending ology means the study of. So it's the study of blood. There is also a department in the laboratory where the blood is resulted that is named hematology. Okay. For example, if any of you know anyone that goes to a heart doctor, they call them specialists, or a kidney doctor, or a person that has diabetes may go to a endocrinology. So cardiology means the study of the heart. Okay, endocrinology is the study of the neurosystem, and then also pulmonology is the study of lungs. So I just want to tell you those other entities to help you know that though that's why those doctors are specialties, because they study the heart, they study the lungs, they study toxins, they study microorganisms, they study blood. So hematology is the study of blood. Microbiology is the study of microorganisms. Toxicology is the study of toxins. Okay, so hopefully that's explained, in an understanding way. These three are most important, so that's why I have them within the lecture. But I just mentioned those other ologies because just to let you know, in the real world, when you see all these things, that means that person is went to school to study the heart or study the blood. Okay. All right. Now, these are also important. I call these the 4-H words. These words are purple in color. If you can see them on your screen, I put them in purple, okay? But if you're glancing at these words, ladies, already without me explaining them, you may notice that they start with HEMO or HEMA. I've already kind of mentioned to you that if you see any word with those alphabets in the beginning of the word, it has something to do with blood. That's why the word hematology is important as well. Okay. But without further ado, let's go over the first H word. It's pronounced hemostasis. It's explained on page 35. Okay. What is hemostasis? Hemostasis is stopping the flow of blood. It's a way for our body to repair itself after injury. So, for example, if somebody gets stabbed or shot or in fall or just something simple, fall on the ground and you skin your knee, you kind of cut open, broke through your skin a little bit and caused a sore. Any bleeding that we do, and once you hold pressure, our blood is made to clot under emergency or under our body being under attack. What that means is that when you hold pressure to stop the bleeding, you are creating hemostasis. You are stopping the flow of blood. Why do you need to know that as a phlebotomist? It's because once you remove the needle and you apply that gauze from drawing blood and you tell the patient to hold firm pressure for 3 to 5 minutes, you are helping that patient's body to go into a hemostasis event. You are helping hemostasis to form. You are stopping the flow of blood. So after those 3 to 5 minutes, when you lift up the gauze to be sure there's no active bleeding, that means hemostasis has been created. Hemo, blood, stasis basically means stop. Hemostasis. You need to know this word and you need to know the example of hemostasis. This big exam, I'm going to test you too to get you ready on my quizzes. But the national exam gives you questions with these 4 words multiple times in different ways. Hopefully, just with this hemostasis, it's no trick to it. It means to stop bleeding. That's it. But I'm just letting you know that every time the body gets injured and it causes bleeding, it needs to stop bleeding because you don't want anyone to bleed out because you can actually lose your life for not being able to, for your body not creating hemostasis to stop the bleeding. So something simple as what you're doing, a simple venipuncture, we still need the body to create hemostasis, stopping the flow of blood. You don't want them to bleed all day. And remember, if the patient is taking a blood thinner and after 3 to 5 minutes, they are still having active little bleeding through that site, then you need to hold pressure for another 3 to 5 minutes, okay? You want to ensure that there's no active bleeding before that patient leaves. Okay, that's hemostasis. Next, the next H word is pronounced hematoma. You've seen it already when we watched the video when we were learning how to insert the needle on Saturday. Hematoma means, it's explained to you on page 131. It is a collection of blood in the tissue, basically a blood clot underneath the skin that can create a bruise. So remember, I mentioned to you all, if anyone has a bruise that you could see on their skin, that means that it's bleeding underneath that tissue, or they were bleeding underneath the tissue, and the blood is all jumbled up in one spot, so it created a bruise. Even a black eye. We say black eye, but that's because it's bruised. So that because it's a little bleeding going on inside the skin in the tissue. That's why it's a black eye, okay? For us as phlebotomists, you need to know the most appropriate way how to not do a hematoma. You do not purposely want to create a hematoma in a person. And let me explain to you why. So on my whiteboard, what are examples that can create a hematoma? Number 1, if the needle is not fully in the vein on insertion, you can cause a hematoma. So what that means is, we know what bevel is. If that bevel is halfway in the vein and halfway out the vein, you can be partially getting blood in your tube, but the other blood is leaking into the tissues. So then if you start to see an elevation in someone's skin, like it's lifting, I need you to pop that tourniquet and take that needle out. At that point, you don't have to worry about taking the tube out because you're trying to stop the procedure as quick as possible. Okay, so you remove the tourniquet and remove that needle and apply pressure because you do not want to continue to draw blood on a developing hematoma. You can make it worse. So that's number 1. Number 2, if you remove the needle before removing the tourniquet, a person could create a hematoma. You can create a hematoma on that person. Let me explain to you. So let's just visualize. All right, you just finished drawing the blood on the patient. You remove the tube, but then you remove the needle, forgetting that you did not remove the tourniquet. And so if the needle comes out and the tourniquet is still tied, that means the blood is confused. Am I to come in or stay out? Because the needle is no longer in the skin, but the tourniquet is still squeezing the arm for the blood to flow out. So some of the blood can come out the site and some of the blood can leak in the tissue. So we have to be sure that we pop the tourniquet before removing the needle, okay? One more thing, if once you apply pressure or get your patient to apply pressure, firm pressure at the site, if that firm pressure, if you barely touching the patient or if the patient is barely giving firm pressure, also the blood will be confused. Are they trying to lock me in here or want me to come out? So if you're barely putting that gauze on the skin for hemostasis to create, some of the blood can be coming out of the site still, and some of the blood could be trying to stop because you have the gauze there, but you don't have it on there tight enough or firm enough. Okay, hematoma, a collection of blood in the tissue. How can you create a hematoma? If the needle is not fully basically penetrated into the skin, halfway in, halfway out, a hematoma can be created. If you remove the needle before removing the tourniquet, a hematoma can be created. If you do not apply enough firm pressure to the site, the hematoma can be created, okay? Next of our H words, this one is pronounced hemolysis, still having to do with blood. But in this case, hemolysis or hemolysis, don't let hearing those words kind of pronounced differently confuse you. Please, again, we're not doing spelling bees. I don't give you a spelling bee, but I do want you to be mindful on how to recognize these words, okay? So hemolysis or hemolysis, however you want to pronounce it, to help you remember. What this means is that every time blood is in the tube, red blood cells is a part of our blood function. It is a part of our blood. So hemolysis means red blood cells in the blood tube have been destroyed. And then the blood would not be able to be resulted because the red blood cells is an important factor of our blood. So if the red blood cells have been destroyed and the lab says that the blood is hemolyzed, hemolyzed is still hemolysis, is just in a past tense way, so to speak. So if you ever get on a report that Winetta Chopin CBC was hemolyzed, that means that the red blood cells in that blood sample in that tube were destroyed, okay? Hemolysis and hemolyzed is the same word. It's just that hemolysis is the word for current and hemolyzed is the word for past tense, okay? How can the blood get hemolyzed, or how can you do this hemolysis? What it is that, as you've been learning, we invert the tube. And I always keep saying, if you hear me, in a gentle side to side. So we invert the tube in a figure 8 motion, gently from side to side. Let's just say you shake that tube up. You shake it up like you're shaking up, anything that needs to be shook up, or you vigorously move it in a figure 8 motion, all fast and powerful. You can be destroying the red blood cells in that tube, okay? So we want to be mindful to handle the specimens with care, okay? We want to gently, from side to side in a figure 8 motion, invert our tubes. Hemolysis, the destruction of red blood cells. A simple and most easy one thing to remember that they're going to test you on is if you vigorously shake the blood tube, okay? Do not vigorously shake the blood tube, otherwise the blood would not be able to be resulted and you would have to stick your patient again because they say that sample is hemolyzed, okay? Hemolysis or hemolyzed, same word, okay? Last H word, it's 4 of them, okay? The last H word is pronounced hemoconcentration. There goes the hemo. Blood is within this word. It talks about this word also on page 125. Hemoconcentration means it's an increased level of blood concentration in the blood tube. How can this happen? So y'all remember, I told you that the tourniquet should not be tied no longer than 60 seconds. Well, if the tourniquet is tied over 60 seconds, you can risk that blood sample having a high concentration of blood in the tube, and it will be considered to be hemoconcentration. So if you can just get yourself into remembering too much concentration in the blood. How can this happen? If we leave the tourniquet on for longer than 60 seconds, longer than a minute. Okay, 4 H words. Hemostasis means to stop the flow of blood. Hematoma is the collection of blood in the tissue. So basically just interpret that as a small blood clot, and it will form a bruise on the patient's skin. If the needle is not fully in the vein, meaning halfway in, halfway out, a hematoma can develop. If the needle is removed before you remove the tourniquet, a hematoma can develop. If you do not apply, or your patient do not apply enough pressure to the site once the needle is removed, a hematoma can develop. Can you get in massive trouble because the patient has had a hematoma? No, you cannot, but you want to do everything possible to prevent it, okay? Sometimes the patient can kind of jerk, and then the needle comes halfway in and halfway out, and you didn't know it, and you're still trying to get blood, and all of a sudden you see the skin lifting. Like I said, remove that tourniquet and remove the needle, apply the gauze for pressure, and just stop it. You'll just have to stick the patient again on another site, okay? Hemolysis, the destruction of red blood cells. The red blood cells have been destroyed in that blood tube. How can that happen? If you vigorously shake that tube, you can be shaking the red blood cells out of that blood sample. We need the red blood cells in the sample in order for the blood to be resulted. Okay. Next, hemoconcentration. It's an increased level of concentration, or increased level of blood concentration in the tube. If the tourniquet is left and tied in place for longer than a minute, you're probably like, is that really gonna happen? It can happen, but I don't really get too crazy if it's been a minute and I'm still drawing blood, but per your textbook, 60 seconds, a minute, okay? So we need to pop the tourniquet. If you're in the middle of a blood draw and it's already been a minute and a half and you're still drawing blood, then remove the tourniquet. The blood probably will still flow. If the blood stops flowing, then you would have to you already popped the tourniquet, but remove the tube and the needle and go ahead and apply pressure. You may have to stick the patient again. Everything to avoid these samples being rejected to where you have to draw the patient's blood again. Okay, so I call these the 4 H words: hemostasis, hematoma, hemolysis, and hemoconcentration. Okay, they all have to do with blood. Will you see these again? Yes, 1,001 times. So get to know them. Okay, let's go forward. When I bring my little slideshow down a little bit, when we look to the left side where you see arteries and veins, typically we have went over arteries and veins. I just want you to know, as phlebotomists, remember, you only draw from veins. You never find yourself drawing from arteries. If you do see bright red blood coming into that tube, then you need to stop what you're doing right away, pop the tourniquet, apply pressure, and stay with the pressure until the bleeding stops. Because typically with arteries, it does take a little longer for bleeding to stop. So that's why we definitely don't want to draw from the arteries. Remember, veins are typically blue in color because they carry no oxygen, okay? They carry the blood, that blood flow is going to the heart. When it comes back out the heart, now it's artery blood that is leaving the heart and coming into our body. So just know, veins is blue because it doesn't carry any oxygen. Arteries are red because they do carry oxygen, okay? As a phlebotomist, you only draw from the vein. And I have this image of this lady standing up so you can see that it all starts from the heart. Everything starts from the heart. And then that's when things branch off. So now we have red and yellow arteries and veins, okay? We have them all over our body, okay? All right. Moving along. I want you to move your screen or look at my screen here in the middle where my words are typed out in black, okay? Now, we've dispersed medical terminology. It talks about it on page 23. And it is named point of care testing. The abbreviation for it is POCT, point of care testing. What that means is, it means that any test that is done near or in the presence of a patient, or that can be done quickly where the results come back rapidly, and rapidly could be up to 15 minutes or so, okay? If you remember, we did a urinalysis dip in the back of the lab. I keep saying the back of the lab, so because we can imagine we're at work. We did a urinalysis dip in the lab on this weekend on Sunday. And if you can remember correctly, I used myself as an example. Okay, I went to the doctor because I was having urinary issues and I needed some relief. I saw the doctor said, okay, Ms. Chopin, I need you to go across the hall to my lab, provide a urine sample so I can see what's going on. That way I could prescribe you something. And then you just come back to the room while we wait for the results, okay? Those results came back, if you remember, depending on which urinalysis dip region strip bottle you had. Some of you had to read 30, 35, 40, all the way up to 120 seconds. The other bottle everything was at 60, and the leukocytes you read between 90 to 120. So what that means is that at 120 seconds roughly, that those were read already and you were done. That is called a point of care testing. It came back rapid. The patient was still there, okay? POCT. Other examples, what we didn't get a chance to do this weekend yet, is glucose test, a finger stick. When we stick that finger and put that strip into the meter, it gives us the results like in 5 seconds. Rapid strep throat. If it has rapid in the test, you already know it's going to come back fast. That's a point of care test. So I need COVID, rapid COVID, pregnancy tests. Whether you went to the doctor to get it done or whether you went to Walgreens or Walmart, those results come back rapidly unless they stuck you in the vein and had to send off your blood work. You know that that's not rapid, okay? If they had to stick you by way of needle into your vein, then you know that's not rapid. So I need you to know, ladies, point of care testing, the abbreviation POCT. Any test that is done near or in the presence of a patient. In other words, also those results come back at a rapid pace. Okay. Next word in the medical terminology is pronounced pre-analytical errors. It talks about it on page 105. What that means is that it's an error that occurs prior to testing the specimen. So before the specimen even went to the lab to be tested, there is an error already made. As an example, patient identification. If you have a Juanetta and a Juanita and you drew Juanita and you're supposed to draw Juanetta, that's already an error, okay? Error that occurred prior to testing your specimen. It talks about it on page 105. Next word, hopefully this will be easy for you to remember because we've already been talking about fasting. Remember, fasting is nothing to eat or drink in a certain period of time. Typically, the most regular routine blood work, if the doctor say you need to be fasting, then it's typically 6 to 8 hours. Nothing to eat, nothing to drink. But let me tell you something, ladies. You can have sips of water. So let's just say you get dry mouth and you wake up in the middle of the night, you can have a sip of water. Let's just say in the morning you wake up before you go to the doctor's office, you brush your teeth, and then you rinse your mouth out. You can have a sip of water. It is meant to not have a whole 16, 20 ounce of water. You cannot do that, but you can have sips of water. Sips of water will not hurt. And it's not me just saying this. It is in the medical world that you can have sips of water, okay? That is fasting. Next, I think we'll be kind of comfortable somewhat over informed consent and implied consent. We went over that this weekend. Just to reiterate, informed consent, it talks about it on page 24, both of them actually. Informed consent is used for big procedures and surgeries because it has to be explained to the patient and the patient has to acknowledge that he or she agrees. Implied consent is used for regular, it's used, I'm not going to say regular because you can't put regular with emergency, but implied consent is used for emergencies. Remember, if someone got into an accident and they come into by way of the emergency room by ambulance and they are unconscious, you can't get consent from them because they are unconscious. But because it's a life-threatening situation, you need to do what you have to do for their medical treatment. Now, if they so happen to have a family member with them, and that family member is a medical person that can make decisions, then that medical person can either tell you, well, the moment that you guys are doing CPR on my mom, she does not want to be living on any tubes. So if you guys can't recover her, that's her wishes, and we have it on paper, okay? But if they have no one with them, or, you know, just know that implied consent means that person implies. Also remember, if you are trying to get someone's consent to draw their blood and they can't really communicate with you like verbally, but they do take their jacket off to give you their arm, they are implying in a nonverbal communication that they want you to draw their blood. So they are giving you permission, okay? Know the difference between informed consent and implied consent. Also in your book, it talks about express consent. Basically, what express consent means is that you did explain to the patient what you're going to do, and maybe your facility say, no, we just get their consent verbally. So they are expressing to you yes or no, okay? Informed consent, they do have to sign something to say that they understand the procedure. You know, you may work in a blood bank or a plasma center. You have to definitely get an informed consent because they have to sign, you know, that if anything shall happen while they're getting transfusions or either giving the blood for transfusion, they need to know their risk, okay? Next, standard precautions. I hope that you are comfortable with knowing this information. Standard precautions, it is very important, means that we wear gloves all the time because we assume that all bodily fluids from all our patients have a bacteria, germ, or microorganisms of some sort. Standard universal precautions. Even though I didn't type universal precautions here, standard universal precautions mean the same thing. So just think of the word standard, general, universe, everything, okay? So that means we're putting on gloves. Remember when we dipped the urine this weekend, I told you always have on gloves before you touch that Regent Strip bottle because that bottle is full of urine, okay? Just to reiterate, our personal protective equipment, PPE, involves our gloves, our gown, our mask, our face shield, and I put goggles in parentheses because goggles can be in the place of face shield. Basically, a face shield and a mask protects your mouth, nose, and eyes. That's why you see people with masks on, and then you may see people with goggles or that face shield on because they have to also protect their eyes. I will talk to you on this weekend, the difference. We already know standard precautions, but what if you did draw your patient's blood, now the blood comes back that they do have a big major microorganism and now they have to be under isolation. So they can have tuberculosis if they cough or sneeze. It could be contagious. They can have some type of bacteria in their urine or their stool to where if you touch anything that they touch, you can catch it. So I will explain that to you. So right now, all you know is that you're wearing gloves all the time. But I do need to teach you in what sense do you have to put on the gown, mask, and goggles, okay? Some of you already got an idea of what I'm talking about because you work in the medical field already, but as a phlebotomist, you need to know the same thing, okay? So PPE, personal protective equipment, I'll talk to you more about it, but that's what that is, okay? Let me go over to my next topic. Here in my green sticky notes. All right. My first word of explanation. It talks about it in your book on page 34. It is pronounced syncope. Syncope. That word means feeling faint or actually fainting. Okay. So if someone ever fainted in front of you or felt dizzy and they had to sit down, that means that they had a syncopal episode or felt syncope. Oh, I feel syncope. You know, from this day, from this medical terminology session moving forward, in previous classes, I've had other people, talk to me and start using the medical terminology word so it can easily help them when they see it again. Okay, so as my little picture I have with the lady on the floor, like, she had a rough exercise, like she feeling faint. So syncope, feeling that you're about to faint, having a feeling that you're about to faint, feeling dizzy and lightheaded, or you really did faint. That's what syncope is, okay? Next word, edema. edema. As you can see, I have a little picture at the top here where you see someone's feet look like Professor Clump's, right? So what that is that person's feet is showing edema. Edema means fluid in the tissue, AKA your feet swollen, okay? So what that means is it's a bunch of fluid in the tissue that's causing those areas of the body to be swollen, to be having swelling. If you ever saw anyone's hands to have swelling or anyone's arms to have swelling, that you trying to get blood from those areas, please do not stick them. You are going to be unsuccessful. The moment that you insert the needle, fluid is going to come out. Even if by chance you actually insert it through the vein, then that blood is going to be diluted with the fluid that's coming from the tissues anyway. So never draw from the areas of the body that you can draw from, but it is showing fluid in those areas. So edema, fluid in the tissue, it's another word for being swollen. Okay? It talks about it on page 157. Next medical terminology. Remember, do not freak out. I'm not going to do a spelling bee with you all, but I do need you to be mindful that you need to recognize these words. This word is pronounced petechiae, 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 petechiae. The example of petechiae is also right here on the side of it, where this arm, the part of the arm look like it may be a little rash or something. What petechiae is small red or purple spots on the skin as opposed to this one. It talks about it on page 145 in your book. It may even look rash-like. But what that is, ladies, is that the tourniquet could be too tight, or that person could have an underlying medical history that you don't know about. And the moment that you inserted the needle, they started to break out in this type of what we call slight rash. But what it is that it is not a rash at all. It's red and purple. If I've already explained to you that a bruise means it's a collection of blood underneath that tissue, and on the skin, it comes out by way of a bruise, that's because it's blood there. Where in this way, it is broken capillaries. When we do finger sticks and I talk about capillary puncture, because that's what that is, capillaries is the smallest blood vessels that we have in our body. It's artery and vein blood put together. So just imagine right now, just think about if you was to stick somebody's finger. You're not sticking a vein. You're not even sticking an artery. It's just puncturing someone's finger and blood just come out. Just think about it. If you just got you some Rachel Ray knives, I don't even, know if they're good, but that's the first thing that came up my mind. Let's just say you got you some Rachel Ray knives. You cooking the gumbo, you cutting up them bell peppers and them onions, and all of a sudden you kind of poked through your finger. You didn't stick a vein, you didn't stick an artery, but you kind of, broke through skin with that sharp knife. That all that blood is inside the tissue. That's capillary blood. It's the smallest blood that flows through our body. So if you were to tie the tourniquet tight, or if you were to insert the needle and the person starts to break out with these red, purple spots, it is not an emergency. You do not have to stop your blood draw. But what that means is, for whatever reason, that person is sensitive and those capillaries just kind of broke off underneath in the tissue. And it's like little bitty dots, that just broke off. But on top of the skin, it looked like, like a little rash light, if that makes sense. Okay. So petechiae is small red purple spots on the skin, and it can come from broken capillaries that maybe the tourniquet is too tight. If you see that and the patient really tell you that that tourniquet is tight, then just undo the tourniquet and retie it a little more loosely, or comfortable. Remember, it's not supposed to be loose, but it is supposed to be somewhat firm, okay? Petechiae, red, purple spots on the skin. It may look like a rash to you, but it's just broken pieces of capillary blood broken inside the tissue. It is not an emergency need for you to stop your procedure, okay? Next word, hopefully it's easy for us to just breeze through this one, because we talked about it on Saturday when we talked about the alcohol we have to use, when we talk about the chlorhexidine that we use, when we talked about the iodine that we use. All those three are examples of antiseptic technique, meaning those are solutions that we clean the site to be sure that it's free from bacteria or microorganisms, okay? For example, that 70% isopropyl alcohol prep pad we talked about, and ChloraPrep pad, that is a chlorhexidine brand. Like in class, I had the Skin Cleanser brand, I had HIPAA brand, I had Walgreens brand, but they all were considered chlorhexidine gluconate. ChloraPrep I put in my sticky note because that's how NHA is going to test you. They're going to talk about ChloraPrep multiple times. Just know that ChloraPrep is a brand of chlorhexidine gluconate antiseptic solution. Okay. Next, ASAP or STAT. That means as soon as possible, ladies. So if you get orders to draw Miss Chopin blood in room 303, working in the hospital at Baptist, and it says STAT or it says ASAP, that means you need to go to her right now and go ahead and draw her blood, okay? If you have 4 orders and they all say STAT, either your supervisor or gonna, even if you, let's just say you are the phlebotomist and your floor today is the 3rd floor, but then all of a sudden you got orders for 3 different people on the 3rd floor that have STAT orders. It is up to your supervisor to disperse them amongst other phlebotomists and have them help you, or it may be a case to where y'all short staff and she tell you to do the STAT orders in the order that they were received, okay? Drawing blood, STAT means that you drew the blood and it got resulted within a 2-hour period. So if you see that the doctor has ordered someone a blood work STAT, that means that they need those results right away. And it's typically, everything is typically done in 2 hours, and the results are back in 2 hours. Okay. ASAP stat means as soon as possible, immediately. Next, in my green sticky note, disinfectant solutions. If I were to ask you, what disinfectant will you use because you waste urine on the floor? Okay. You're not going to use chlorhexidine gluconate or iodine or 70% isopropyl alcohol that you use for the skin. You are going to use a disinfectant solution for surfaces. Surfaces means floor, doorknob handles, cabinet doors, whatever are surfaces. Those things you will clean with bleach. For some of you that work in a medical facility now, I want you to be nosy and like those Cavalcade wipes or whatever is used for disinfectant that you use to wipe down, you know, the tables or anything. I want you to grab it and look at the ingredients, kind of like how we did in class when I made you look at the ingredients. It's going to say bleach. It will have brand. Miss Kiara may have her own brand. Kira may have her own brand. Miss Francis may have her own brand. Miss Tracy may have her own brand. Shayna may have her own brand. But even though y'all have your own brand and it's named something different, the ingredients is still going to be bleach and water, pretty much. Okay. So I need you to know that the disinfectant solutions to clean surfaces is basically water and bleach. A ratio from 1 to 10, what that basically means is that for every 10 ounces of bleach, we're going to use a cup of water. We know when cleaning up at home, we dilute our bleach or Clorox with water, right? So that's exactly what these healthcare facilities are using. It's just a different, it just slap a name on it, but the ingredients are still bleach and water. So I do need you to know the difference between disinfection, disinfectant for surfaces versus aseptic technique for the skin. Okay. All right. If I don't have any other questions, I want to go ahead and move downward on my. We're going to do capillaries in class because, you know, we're going to stick the finger to do blood sugars, but I've kind of slightly explained capillaries already, which is the smallest blood vessel, and it contains both venous blood and arterial blood. If you look at this pink image, you'll see how you have the vein on one side and you'll see how you have the artery on the other side. But you see the middle, these little bitty, you know, little stringy things, that's considered to be capillaries. They are the smallest blood vessels in our body, and it's combined with both vein blood and artery blood. But we'll talk about that more, okay? I'm not going to test you on capillary blood right now when I know that we haven't did the example or the demonstration. But now I do want to go over positions a little bit. I have my pink sticky note here versus my little image of my lady here with no face. But anyway, I'm going to go over it in just a minute. So give me 1 second. I'm so sorry. I just. All right. So what this means is that in medical terminology, some of you may already know the positions. I know that, but I do need to explain it so you could be refreshed and for those that don't know. So you see my lady here. On one side, she's lying on her stomach, laying on her stomach. On the other side, she's laying on her back. Just imagine if you are a person that likes to sleep on your stomach versus a person that likes to sleep on your back. I'm not sure. But I need you to know the medical terminology for those. So if you find a person that is sleeping on their stomach, that means that they are lying in a prone position. Prone, prone. If you see the patient and he or she is lying on their stomach, on their back, or you may be giving CPR to that person, they are lying on their back. You need to know that they are lying in a supine position. It's pronounced supine. I had a student that tell me that they remember that because soup goes in a bowl and a bowl is pointed upward again. If you find that that is, you know, like, okay, I can see that. Or if you find, I don't remember it by that, you know, choose your pick. But remember, in everything that you're learning, try to find an easy way so for you to remember. The reason why I'm teaching you these is because in medical, a person is technically always laying on their back, so they're considered to be in a supine position. A person is never really going to be laying on their stomach. But I need you to know the difference, because you may get a question that's worded that, okay, as a phlebotomist, you find yourself giving CPR. The patient is lying in a prone position, and you're giving CPR. Is that correct or true or false? And hopefully, if you're confident in knowing the difference between prone and supine, you know that you cannot give CPR to a person that's lying in a prone position. So that's why I have to teach you both, because you need to know the difference, because it can give you a question with both of them in there, and you have to know the difference, okay? So when I go up to my little pinkish sticky note here, supine, lying down, face up. Prone, lying down, face down, okay? Now, when I go back to my little image with my lady with no face that we see, you see her lying down. One is on her right side, one is on her lateral side. Now, granted, you see one of her arms is behind her head while the other arm is kind of over her stomach. I don't want you to concentrate on it, okay? It says right lateral, left lateral. Recumbent, I don't want you to concentrate on that word, because recumbent is basically the position of her, why her hands is laying the way that it's laying. I need you to know the difference between I need you to know what the word lateral means. So obviously it says right lateral, then the other says left lateral. So I hope by now you figured out that lateral means side, okay? So right side, left side. So the medical terminology for side is lateral. Lateral, lateral, meaning to the side, okay? Another word that I want you to study and remember. You see the lady, and she's kind of sitting in a reclining position. Imagine that she's sitting in a recliner, or imagine she's in a hospital bed, and when you walk in her room, her head is kind of, you know, it's elevated, but in a reclining elevation. The name of that position is considered to be pronounced Fowler's. Fowler''. So think of Fowler's as a sitting reclining position. That's it. Okay. So when I go back up to my pink sticky note up here, and it says Fowler, reclining position. Whether someone is sitting down, or whether they're in a hospital bed reclined back, or rather you're lying in your bed at home and you don't have no electrical, you know, one of them Tempur-Pedic expensive beds that you can have the remote to go up and down, but you may have a bunch of pillows that you prop yourself up to make it seem like you're in a sitting reclining position. That is considered to be the Fowler's position. So basically, supine and Fowler's are important, because if you get a patient that says that they get dizzy to the sight of looking at a needle, or sometimes they feel dizzy when they're getting up after a blood draw, those people, you may have to already lie them down or already recline them in the Fowler's position. So if you may get your manager, and don't get me wrong, nowadays, a lot of these medical facilities do not use medical terminology. They just straight up and say, lie her on her back, or sit her to where she's reclining, right? But on the exam, it's going to literally have these medical terminologies. So you do need to know what supine is. You do need to know what lateral is. You do need to know what Fowler's is. You do need to know what prone is, okay? And last but not least, that word dorsal that I talked about a little earlier, DORSAL, it means the back. So when you're having to draw blood in the hand and you see words that say dorsal metacarpal, that means the back of the hand, because metacarpal means hand, dorsal means back. So dorsal metacarpal means the back of the hand. If somebody say, okay, Miss Erica is standing dorsal to the refrigerator, that means she's standing with her back to the refrigerator. Okay? Dorsal means back. So I need you to, get in a little routine of knowing what these are if you wasn't already comfortable with this. Some of you probably were. Okay? All right. So it's two sticky notes up here that I actually really do not want to talk about just yet. Clinical laboratory, you can screenshot it, and all that, or you can even look at it if you want. Clinical Laboratory and Standard Institute, and then Clinical Laboratory Improvement Amendment. I will talk about it on Thursday. Also, anticoagulation versus coagulation. I will talk about that on Thursday. Okay. So this concludes our medical terminology for the most part lecture. So hopefully you were able to screenshot it so you can always follow, or maybe you wrote down notes, whatever works for you. Okay. All right, it's 8:08. I do want to show one more video, and it's to reiterate what we already know. But again, I want to keep the information going. I like to, say and show you things over and over, so everything can stick to you. All right. So hopefully you were able to screenshot. I'm gonna go ahead and unshare my whiteboard. Give me one moment, ladies. We're reaching the end. Well, we're to the end. This one is a little under 5 minutes, so give me 1 second. I'll tell you. All right.
Welcome back to Providing Solutions.
Okay, let's talk about the first P. Of course, we know patient ID. Now, we always ask them for their first and last name, and of course, we have them spell it out to you. We don't want to tell them your name, so never tell them their name. We want them to tell us, and of course, in turn, spell out their first and last name clearly. And again, this avoids any miscommunications, because a lot of times patients have a hard time hearing or a communication barrier. So if you tell them their name, they might hear part of it, but it could be a different last name, but it sounds similar to someone else, and they're just nodding their head and saying, yes, that's me. And then we've come to find out that it's not really the same patient, that we have a different patient with a similar name, either first or last. This is why we always ask their first and last name and have it spelled out to them, or actually out to us. And of course, we always want to ask for date of birth, ask them to tell you their date of birth. Again, we never want to tell them, is your date of birth such and such date? Because again, they could misunderstand, mishear, not really clearly heard, but maybe they heard, the year was correct or part of the numbers were right. We never want to do that. We want to ask them to tell us their date of birth. That way we can get confirmation from them directly. And of course, we might, ask for extra information if we need to confirm with the medical record number if we have it, or ask them to confirm their address or telephone number. Those are some extra things that might be required by a lab. Hospitals usually don't, but sometimes when we have outpatients coming into a lab and so forth, we might have to ask to confirm name and address. And I always ask them on the requisition sheet to initial where their name is and date of birth after I confirmed it with them. I have them look at it on the paper, make sure everything's correct, and initial on there. That way, it protects me that they verified the information on the paper as well. Okay, the next two P's, second and third, are the ones that are rarely, if not never, asked to a patient. The next P is patient complications. Ask the patient if they ever experienced any complications during a blood draw, as in passing out or getting lightheaded. Now, this allows you to determine if they should be seated upright or if they should be in a reclining chair. Safety is the first concern. Now, again, I've had many students talk to me about this, that they've never had or seen a phlebotomist ask this question. And they've witnessed firsthand patients falling over on the chair, getting lightheaded, and even standing up and collapsing right after a blood draw. Again, these are a liability to the hospital or clinic as well as to the phlebotomist. So we must ask if the patient has any complications. And this is very important because this will determine if we should put them seated or if we should lie them in a reclined chair if they do have any fear or issues with blood draws. And of course, the last P is patient medications. Now, you should ask the patient if they are on any medications, as in blood thinners, even aspirin. Now, patients come in who are older, who might be on Coumadin, warfarin, heparin, or even on taking aspirin daily, and this will tell us if the patient will continue to bleed longer after the venipuncture was performed. Again, this will likely determine if you hold pressure on the puncture site longer than usual. Typically, we hold pressure 3 to 5 minutes or allow them to hold pressure for 3 to 5 minutes and then come back and check to make sure that we have hemostasis, that the blood is controlled or stopped bleeding, and then we bandage them. But if a patient has or is taking certain blood thinners, then we need to understand we might have to hold pressure longer. We don't want a patient walking out bleeding through the bandage or walking out and then all of a sudden blood starts to pour into their car or on the way home. We want to make sure that we have controlled bleeding and the patient understands that they might have to hold pressure longer. Safety is first concern for the patient. Again, this is a liability if we fail to identify if the patient is on any medications for allowing to hold longer pressure on the site. And for more information, please visit our website.
All right. So, as I mentioned, we've already talked about that information, but hopefully by you hearing it being explained by someone else and hear a different voice, hopefully all that stuff can stick in, because we will basically do a reenactment with those things. With that patient identification, we would do reenactment on those 4 questions so you can get used to this stuff. And it really is easy. And once you actually get comfortable, and I solely believe, I don't know how you all feel, but if you're constantly talking to your patient, even though you may be nervous, when you're constantly talking to your patient, I do believe that is a good technique on how you can be relaxed, because you're talking to your patient and you're moving and grooving, and you just stuck one patient, now you're on to the next, now you're on to the next, and you're just getting better and better with your communication and with your skills, okay? So ladies, thank you for your attention tonight. I know that it was a lot and it was over Zoom. I hope that you took good notes, because we're pressing forward. Tomorrow is quiz number 3. I know typically every Monday, Wednesday, and Friday is the quiz, but you all have 2 quizzes back to back. But tomorrow is its regular scheduled quiz, and it's considered to be medical terminology. So most of everything that I've talked about today, and I may have thrown in a couple of other things that we have already went over the weekend and even on our first and second day, just to keep that information, that memory going. But it's only considered to be medical terminology words, like definitions on the next quiz. So be mindful. A lot of people think that, oh, you just went over a lot of stuff. But like I said, just kind of, study. When you do the quiz, maybe you'll take, that quiet time out of your day to go ahead so you can take your 30 minutes or so to concentrate on it to do it. But just gear yourself in these way of the quizzes, because like I said, a lot of this information you will see very similar on your big exam. So, you don't have to, be so nervous when you take it, with the hopes that you don't be so nervous. But other than that, ladies, do I have any questions for tonight? Thank you all for y'all attention as always. Any questions? Oh, hold on. I see some. Oh, by the way, let me stop that.